We've used the UbiDuo here at Calloway Community Hospital for about 4 years now. It is quite an easy tool to use. I'm the director of radiology, as I said, and our tests can become pretty complicated and pretty scary for patients. We're able to instruct them on positioning them properly, what to expect from the equipment that's very big and overpowering to people. We are able to make it convenient for the patients in that we have it available right here at the hospital. It's quick to set up, it's easy to use, and we can avoid waits for interpreters to arrive from other towns around us. We would first sit down and explain to the patient what the procedure is like and what to expect. That would be first. Ask them if they have any questions. Sometimes it's really important for us to know what medications they've been on, have they eaten that day, those types of things. And so we use it then to communicate to get those answers for things that we need to know that pertain to the quality of the test we're to perform. It's important to get it quickly so that we can save time for the patient when they're there. Equally important to get it accurately. If they're able to read a script and to type back to us, gives us a better understanding that there's no mistaking in what they can expect. And if we have to alter something about the way we perform the test, then we'll know that ahead as well, as opposed to getting into the middle of something and then having a patient move or breathe or something like that that would cause us to have to repeat it. As opposed to us writing everything down on paper, the patient as well as the technologist, back and forth, it's just easier, and I think it allows us to have a better understanding and be more accurate for each person as to what to expect. It's there in black and white for both people to see, so I think it's just a more accurate, effective method of communication as opposed to writing and misspelling and legibly and the types of things that you go through when you are trying to write back and forth and make people understand what you're asking them to do and the questions as well that they have for us. I think any time that one is required to communicate with another, which is many opportunities during the course of the day in the community, in the hospital, wherever you may be on a job, that it would be an effective use of communication, yes. I would say based on experience that we've had here at the hospital and that I've had in my department, it's an effective communication tool. It would certainly be more cost effective than to have to wait on an interpreter, probably more effective and more clearer instructions as opposed to writing on paper. And it's pretty quick. You can do it pretty efficiently.